Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. I'm Tom Lochter of the UTHSC's Teaching and Learning Center. Each month, we interview members of our faculty about their research and its impact on the higher education community. This is the second of a two-part series on a paper titled Medical Student Use of Practice Questions in Their Studies, a qualitative study published in the October 2024 issue of BMC Medical Education. Today, we continue our conversation with Dr. Trevor Sweatman and Dr. Devin Scott of the University of Tennessee Health Science Center, Brian Sheehy of the Kansas University School of Medicine, and Eric Nemec of Sacred Heart University. What were some of the more interesting findings in your study? Any of the comments that stood out for you?
We had three primary findings. One, students are using practice questions for primary learning. Two, that students are really interested in rationales, and that's one of the most important parts for practice questions. And three, students are using practice questions as single use. All three of those were surprising for me. I don't know if they were surprising for everyone, but as I was conducting these interviews, I was surprised. Eventually you reach saturation. I was no longer surprised, but I was surprised by that because I had always used and I had always recommended the use of practice questions for self-assessment. So I didn't even think about using them for primary learning. The rationales, I guess I was operating under the misguided assumption that, yeah, students were using these for self-assessment, but they were just interested in if they were right or wrong. They weren't really reading into the rationales. And so kudos to students for reading into the rationales there. That was a good surprise. Third, that practice questions were single use. Now, I had thought that if students got the practice question right, okay, on the first go, that's a single use. But if they had gotten the practice question wrong, that students would go back and revisit those. And so I was surprised that students were not doing that. And in terms of comments from students, one thing that didn't really make it into this paper is that students were talking about when they would use the practice question. And they were talking about how close they would use it to the exams, but they were also talking about like the time of day, right? And so students were talking about, when I go down to bed at night, when I'm tired, that's when I'm looking at these practice questions. When I'm finished with the thought-intensive studying for the day, that's when I'm using these practice questions. When I need something a little bit more low effort when I'm studying, that's why I'm using these practice questions. And I would have thought as practice questions as, okay, this is when I'm simulating an exam environment, right? So I'm on point. Maybe it's first thing in the morning. Maybe it's after I've eaten something and I'm ready to go. And so students were using practice questions because they were using them for primary learning. They were using them more like flashcards. And they were using them when they didn't have as much cognitive capacity for long-term recall and things of that nature. And so I was surprised about almost every aspect of this study.
Do you think that's a reflection of the shortening attention span of students in general? The fact that these are discrete events, if you can use that expression, and they are using them as such, rather than having to construct a continuous full effort. It's one and done, one and done, one and done, and it breaks it up into discrete segments.
Well, yeah, and you get a sense of accomplishment, right? You do a practice question, you get it right. Great, that's good. That's that's a little charge that I'm getting there, and it's easier. I'm gonna if I'm a student and I'm not understanding the why, and I'm not understanding that the best use of this, or maybe I'm not fully embracing that the best use of practice questions is for self-assessment, then I am going to save them for when I'm laying in bed at the end of the day, and I'm going to just run through them like I would run through flashcards. Or we know how students often study is they just reread material and they use their highlighter on things, and that's not an effective method for long-term recall, but it's easier, right? And I feel like I'm using my time wisely. Okay, I'm too tired to understand these big concepts and to work on this, so let me just go do some practice questions. And it feels like I'm learning. I feel like when I get one right, I am succeeding and I am doing something well, but I'm not really. It's all about the perception. To Eric's point earlier, it's his perception that this learning is happening when it's not as effective. Yeah, so I agree with you, Trevor.
All my nodes are now yellow. I must be in my brain somewhere.
What's really interesting about this discussion is I remember when Eric and I were going back and forth running the discussion, and we were trying to put more I guess we were trying to put more educational theory into the paper. And he talked about cognitive load theory and how practice questions allow for decreases in various aspects of cognitive load. And I don't know if he wants to talk more about that, but I just thought that that was a really interesting way to think about it.
You're right. We really tried to link contemporary student perception to some classic learning theories like cognitive load theory. And so I think we did a decent job of highlighting how students value those well-structured explanations that then clarify reasoning and then reduce their extraneous cognitive load, or at least how they perceive that cognitive load. We might perceive that as learning, but their perception, if I'm overloading working memory with unnecessary details, that impairs learning. So theoretically, it helps kind of sift through to what Trevor was talking about earlier, hopefully the black and white, which I think most of us here teach pharmacology and recognize that that's not always the answer, if ever. And so some of the implications of this go back to being able to provide the explanations to the questions, right? Make them concise, but conceptually robust, avoiding extraneous stuff that the student doesn't perceive as valuable. Using visual aids or concept maps can help manage cognitive load by breaking down complex topics and making it feel at least a little bit more manageable for the students.
Yeah, we also talked about how it could potentially reduce extraneous load by pointing them to the topics that they should focus on. I thought that was really interesting way and why maybe a student might gravitate to doing practice questions late at night, because now they don't have to use as much cognition to try to get through these concepts, because now they have this roadmap to the important concepts that the professor finds important.
Any other learning theory that can connect to what you all found in your paper?
One other learning theory that comes into play here is the information processing theory, and that's thinking of your brain like a computer. So, long-term memory relies on rehearsal, encoding, and retrieval. And so practice questions are allowing you to practice that theory, but if you use it in the wrong way, then you won't have that encoding of that long-term memory. And so that's another theory here that comes into play with practice questions.
Now, when students are answering practice questions, are you encouraging them to just think through the answer, to write through the answer, to speak the answer? Because the way that memory works is different depending on what their output is, right?
Well, it's really fascinating that you asked that question, because the most surprising finding from this study for me was that when looked at the transcripts and was coding, oftentimes a student would not select a correct answer. They would just go to the rationale and read it. And to me, that was the most surprising finding and kind of speaks to your question.
And I would say that that's probably not the most effective way to really learn that material, right? Is just by reading it.
Because you're convincing yourself that you know it.
Yeah.
Yeah, and they didn't want to answer the question for me. So one of the things we did was Ryan wrote a practice question, and then I had students work through the practice question and then talk me through what their thought process was and how they went about resolving it. And that I could tell was sort of a strange experience for them, thinking meta about how they're going about this practice question, right? When they're running it at home, they're just looking at the question and then selecting a right answer. When they ran it with me, they didn't want to give me a wrong answer, so they jumped straight to the rationale. I think that's one of the reasons they didn't want to give me
Oh, interesting.
right. They jumped straight to the rationale. They didn't want me to judge them, even though I was not judging them. But I'm interviewing them, right? But I could tell that it was a strange experience for them thinking through their thought process, right? And so I think that's something that we might focus on in the future is making that explicit. Like, what ways can you think through practice questions? And then having students do that as a way to more deeply understand the practice questions, but also the content and their understanding of the content, and make it a little bit less black and white.
Is there a way of modeling that process in the classroom?
I think that's a very, very important point, Trevor. We're seeing students use these questions probably different than we intended them to use them. And so we as educators should model and perhaps teach them a little bit about how to self-assess and how to go through those explanations. Because again, if they are using for primary learning, which probably wasn't our original intent, let's help them at least be as successful as they can with that by ensuring that they structure and time things out appropriately so that they are prepared for examinations and prepared with keeping things in long-term memory.
So, in regards to the students using the questions in a way that wasn't intended, let me ask the following. Could we, in fact, do them a disservice by increasing the number of practice questions we provide? Because we always hear, you've all heard it, more practice questions. Well, I'm up now to 600 practice questions in a semester course. 600 questions, let alone the exams involved. Am I doing something wrong? Should I be cutting back on the number of practice questions?
I don't know. So, in one conversation I had with students, and take this with a grain of salt because it's a conversation with one set of students, they described to me that seeing practice questions in that way and starting to see between sessions the important concepts that would rise to the surface, that helped them feel confident that they got it. And the student described it as seeing the matrix of medicine. And I liked that because I can see the little floating green numbers come down and the cat walk across the screen twice. And I think that that's really interesting if you think about it that way, because now the student is feeling confident that they've zoomed out. Because I'm always trying to get students to zoom out from the 50-minute sessions, the 30-minute sessions, because they have to zoom out. When the patient comes in, it's not 50 minutes with a patient that, has some sort of disease. It's, it's complex, and they have to zoom out and they have to integrate the concepts. And so I think that that's one way that they're using these practice questions. So I don't know if it's necessarily a bad thing. It might just be another thing.
So, I like the Matrix reference, Ryan. It took me, I was trying to process it after he said, I was like, what's this double cat thing? And then I got it with the numbers going down.
Let's talk about how technology can play into this. Is there a role for technology in how either practice questions are created or the way that students use practice questions?
I think so. And if I were to be completely honest with myself and you all, the students are probably ahead of us in terms of how to use technology to make this happen. I know for a fact that my students take PowerPoints and use generative text to create question banks for themselves. But I've also tried that. And these are not very deep or complicated questions. They are very surface level. And while it makes them feel confident they know the material, it's often not at a deep enough level to be successful on a higher level question. But there are so many tech platforms right now, apart from just generative text, that I think we're just starting to scratch the surface. Amboss, Anki, Quizlet, QStream, ChatGPT, you name it. I feel like the students have figured out ways to make their studying habits easier on their end, at least perceived to be easier. Effectiveness, we don't know. I have a catchphrase that I tell all my colleagues, and that's students be students. And I see that sometimes students look for the easiest way to accomplish a task, right? And often it's the most efficient way of getting things done. It may not be the way that I thought about accomplishing it. And so you have to take that into consideration, that there are ways to work smarter at times. And a lot of the students have figured that out. And sometimes we can take a note from that. But I do think there's still definitely the role of the subject matter experts, even in the world of AI, to be able to link everything together, to try to sort through those explanations, to help remove the extraneous material, to give as much black and white as we can in a world of gray.
So we've been focusing on medical students, but are there takeaways that other health professions, those that are teaching nursing or dentistry, pharmacy? Trevor, you teach a lot of the programs outside of medicine as well. Talk a little bit about the implications for students in other programs.
Well, I think perhaps the implications for other programs are largely contingent upon how their curriculum evolves over the semester, in the sense that in the College of Medicine, we have a discrete period and then everything stops and there is an assessment. For example, I teach, as you alluded, in the PA program. The PA program doesn't stop just because I have a test on Tuesday afternoon. So the students are actively engaged in other things immediately before my test and immediately after my test. It's a different construct for the medical students where they have a couple of days, then they have a test, and then they have a short break, and then everything starts again. So I don't know if students in other programs, given their timetable, would use practice questions in the same way that the medical students could. We've got to put things in context, I think, because that largely dictates their behavior.
I have a suspicion that students will be students and they will look for the most efficient way to use things, and they'll use practice questions for primary learning and single use. I don't know about rationales, outside of medicine, but I have a suspicion that many students are using practice questions not for a self-assessment, but for primary learning and one-time use. And I think all of our insights on that are certainly applicable to not just the health professions, but students writ large.
So I think that the answer to this next question is going to be in part based on some of the things that have come up during our conversation. But what are some unanswered questions? What's the next research paper that we're going to be talking about in this podcast in future months?
I've been putting together, well, I actually just submitted an internal grant at KU to continue this research to look more quantitatively at the question. This was a very much a qualitative study. And one of the biases there is it's such a small sample size. I want to look at a larger sample size across medical school classes to see if these themes emerge and are confirmed. So one way that we're going to do that, or I'm planning to do that, is to take these qualitative themes and generate a survey based off of the themes. And the other way is to use some hard numbers from databases like the learning management system. So at KU, we use Blackboard, but also to look in the practice question resources that students have access to. So here at KU, that's AMBOSS. But as an administrator, I can get in there and see, okay, did students access the practice questions immediately prior to an exam? How often did they repeat the questions? So I can get hard, unbiased, valid data from those kinds of databases. And then my plan is to try to use some triangulation to see if there are any divergent or convergent themes that happened by looking at all three of these data sets combined. The ultimate goal, at least when I kind of set out to try to do this, was to create some sort of, and I have no idea what this would look like, and I don't necessarily have the technological chops to make it happen, but some sort of practice question platform that would combine some of the things we've been talking about today, the best practices in teaching and learning, with how the students actually use the practice questions. So I think that has our best chance, our best shot at both increasing satisfaction and outcomes. And I think that's kind of the golden cup of teaching is to get all both of those done. The other thing I'd like to do is to look both horizontally and vertically with this question. So what do I mean by that? So horizontally, I'd like to look at other health professions, maybe even other professional students. As Trevor was saying, they might use practice questions differently in nursing versus dentistry versus allied health versus pharmacy. There's so many that we could look at. We could even include other professional programs like law school. I just think it would be really interesting to see how students of different professional doctorates use these practice questions. And then vertically, what I found was really interesting is I was having a conversation with the dean of the Salina campus here at KU, and he was retaking his surgical boards for recertification. And I said, well, how did you study? And he said, I did practice questions. So it's very interesting to me that even like at top level, at a dean level, they're using practice questions to study all the way down to medical school. And so I'd like to look like from undergrad to medical school to residency to, beginning attending all the way up to when you're a dean, how the perception of using practice questions and does it change? And some questions around that. I haven't really fully fleshed that out, but it seems that this cup of coffee conversation we had outside of Starbucks, Trevor, has really morphed into quite the line of inquiry, which is actually pretty neat. So those are kind of my thoughts on the future here.
All right, this has been a fantastic conversation. I really appreciate everything all of you had to say, and like I said, it was a really interesting paper, and I hope that other people find good use for it. So thank you all for participating today.
Thank you.
Thanks,
Thank you. It was fun being here.
And that's this most episode of Teach Well, Learn Well. Thank you to Dr. Trevor Swebin, Dr. Devin Scott, Dr. Ryan Sheehy, and Dr. Eric Nemec for their time. Join us next month for part 2 of our interview as we dig deeper into the theory behind how students are using practice questions. I'm Tom Lochner at the Teach Well Learning Center at the University of Tennessee Health Science Center. Until next time.